I wanted to do a quick talk today about OCD. I treat a lot of OCD, and I find there's a lot of misunderstandings around it. We all know that people are like, I'm so OCD, I'm OCD. And of course, like being clean and really liking things organized is not a part of the disorder. But I figured I would take a minute and just clear up a few things and give a little bit of input. There are different types of OCD, and most people don't know that. If you ever Google, like, do I have OCD? You're going to typically see what your traditional OCD is. And that very often can be very problematic and very difficult. It can make it to where you can't go to work. It can make it to where sometimes people have to line up things, long bathing, hand washing until sometimes, there's bleeding. And traditional OCD can be very problematic. But there are a couple of other types of OCD along the line of pure OCD, where the behaviors and the rituals are actually all in your head. And that is the type of OCD that very often gets overlooked. For pure OCD, sometimes it looks a lot like intrusive thoughts, counting, rituals, just an intrusive thought process that really interferes with a lot of your day. There's also another type of OCD that I feel like we should talk about because not many people do. And there's a significant portion of the population that does struggle with this. And they're so afraid to talk about it, which is fair. Because if someone did not know enough about OCD, it could be very intimidating to talk about, but it's called harm OCD. This is not something reflective of someone who is going to harm anyone, but very often there's people who either have a thought. I'll give you one that I heard online that kind of stuck with me. It was a guy who was in the gym, and there was a girl laying down, and he thought, what if I was walking past her and I dropped the weights on her head? It would crush her head. In his mind, which of course he had never hurt anyone, he never wanted to hurt anyone, but he was horrified, thinking, am I terrible? Am I a monster? Should I talk to anyone about this? Or are they going to be concerned with me? And that, it gets a little bit more extensive with that. A lot of times it's someone who's seen a scary movie, and maybe the image gets stuck in his head or her head, and they think, is there a reason this is stuck in my head? Am I a killer? Am I a bad person? And usually no, it's just a thought process characterized by intrusive thoughts, and it can get really hard too. But the pure OCD, the harm OCD, some of these others where you don't see so many indicative behaviors get overlooked, and people really struggle. With all OCD, we have biological factors, and then we have environmental factors. But OCD is a disorder that has a lot of biological factors. So you're going to see very often like a family history of some of these things. And it is one that is very well treated, both through therapy and through medication. And it's usually treated with a very mild medication, which is an SSRI. But it's luckily one of those diagnoses that has a great prognosis, and we have a really solid idea of what treats it best, which is not something I could say for all diagnoses. But with OCD, we have really, really good results. A lot of these people are incredibly successful, and they do, good work in the world, and very often they've got a lot on their plate because sometimes they are perfectionists, which is not OCD, which is OCPD, which is related, but it is a personality disorder, and it is characterized by almost like an extreme perfectionism. And I won't make this video too long, but that's one you can Google. But OCD, pure OCD, OCPD, all treatable, but all very, very hard on the individual. And the pure OCD, the harm OCD, and the OCPD very often go missed. So what do we do to treat it? I usually like to do these these talks, because I'm very aware that not everybody has the time or money to go to therapy, and the elephant in the room is most of us therapists are pretty backed up. Many of us backed up, 3-6 weeks, and so it's not easy. Healthcare is not always, or mental health care is not always so accessible, but absolutely, there are things online that can help. If you Google these things, there's a lot of knowledge out there about them. Of course, I do recommend therapy, and I do recommend talking to your doctor, and this is in no way in place of that. But exposure CBT has been found to be very effective, and that is primarily what I use. I'm a big fan of it in conjunction with medication management, which I do not do, which I refer out, to primary care provider. And I always talk about the core of overcoming OCD is we walk towards fear. That is a part of my spiritual life, and that is a part of my clinical life, is we don't back down. We don't walk away from what makes us afraid, and we walk towards the fear. And that is actually where we find peace and where we find healing. So another thing you can Google is always coping mechanisms. Use the good ones, not the bad ones. You know the good ones because they are long-term safe. Bad coping mechanisms are always like good in the short term, but bad in the long term. So the good ones are walking, talking to a therapist, talking to a friend, exercise, eating healthy. So anyways, that is my little mental health minute. Sorry, it was probably shaky in the car, but I figured while I'm a passenger in the car, why not try and help people? Have a great day.